Hello and welcome to my comprehensive guide on medication reconciliation. This guide is designed specifically for beginner pharmacists and other related professionals. But before getting started, I am Sam, and if you're new here, kindly consider subscribing to my channel by clicking on that red button below. Now, let's dive in. Medication reconciliation is a critical process in healthcare that ensures patient safety by identifying and reconciling medication discrepancies. It involves comparing the medications that a patient is taking with newly ordered medications to identify and resolve discrepancies. This process is strongly recommended to be performed for patients in hospitals, clinics, nursing homes, and so on. The optimal time for the mentioned process is within at least 3 specific time frames: within 24 hours of patient admission, during patient transfer between wards, and at the time of discharge. Of course, in some cases, 1 day before having an operation is also acceptable. In 2005, the Joint Commission, a US-based nonprofit that accredits healthcare organizations, has played a significant role in promoting medication reconciliation. Let's take a look at steps to be followed for medication reconciliation. The first step in medication reconciliation is to develop a comprehensive list of all patients' current medications. This includes prescription drugs, over-the-counter medications, herbal supplements, and vitamins. The list should include the name of each medication, their brand names if needed, the dosage, frequency, route of administration, and a few more details. This information can be obtained from the patient, their relatives and caregivers, healthcare providers, medical record, medicine box, and the dispensing pharmacy. If an in-person interview is not possible, you may need to call these sources in some cases. In this interview, you also should ask patients' history and special circumstances like pregnancy, breastfeeding, G6PD deficiency, alcohol consumption, smoking, liver or kidney impairment, using antibiotics within the last few months, a history of recurrent seizures, and so on. Next, you need to create a list of medications that the patient needs to be prescribed. This could be a new medication or a change in the dosage or frequency of an existing medication. This list should also include the name of the medication, the dosage, frequency, and route of administration, and so on. Now, it's time to compare the patient's current medication list with the new prescription list. This comparison will help you identify any discrepancies, such as omissions, duplications, dosing errors, or drug interactions. I'll talk about each of these discrepancies in another video. Anyway, this comparison is a crucial step in preventing medication errors. Once you've identified any discrepancies, the next step is to clarify them. This might involve contacting the prescribing physician or other healthcare providers for clarification. You should also assess the medication and doses listed for appropriateness based on the patient's current health status and other medications they are taking. After you've reconciled the medication lists and clarified any discrepancies, the final step is to communicate the revised list to the patient and their caregivers. This ensures that the patient is aware of the medication regimen and can help prevent medication errors. Pharmacists should provide easy-to-understand information about all medications the patient has to receive, including both the discharge prescription items and the medicines previously taken for chronic diseases such as hypothyroidism or hypertension. As a special offer, pharmacists can provide a medicine timetable in which the patient clearly knows what drugs must be taken at specific hours. In conclusion, Medication reconciliation is a vital process that can potentially decrease the medication-related events and the associated costs of care. As a pharmacist, you play a crucial role in this process. Your unique skills and knowledge make you an ideal candidate to ensure that medication reconciliation is successful. Remember, medication reconciliation is more than just obtaining an accurate medication history. As an active process that involves several steps, understanding the process, the staff involved, best practices, and pitfalls helps to ensure optimal medication outcomes. Thank you for watching, and if this video was useful for you, please subscribe to my channel and don't forget to click on bell button below to be informed every time I upload a new video. Until next time.